I am inspired every day by the journey of our patients. Again, first and foremost, just what they are dealing with is a lot. And it's not easy. The way the brain works, it kind of shuts down when our stress gets high. And we also have a tendency to want to kind of put the responsibility onto a knowledgeable, like a doctor kind of thing, and just let them tell us what to do when we feel really overwhelmed. So for people to kind of push past those kind of natural desires in the brain to be looking for alternative therapies, and I don't mean alternative as in non-evidence-based, I mean alternative as in leading edge medical science based, to be willing to educate themselves about things like genetic testing, targeted therapies, and so many new options for therapy. And then to take the time, or to have a family member that takes the time to educate themselves on how to advocate for these things and get access to these things. That's not easy to do at the best of times, but when you're dealing with a life-threatening illness, it's really hard to even just get yourself to focus. So I have incredible admiration, really, for patients who are seeking better options and seeking those through medical science. The other thing that I really admire and really appreciate about our patients is when they do successfully advocate for themselves. Again, it takes so much courage. We have this idea in our mind that my doctor will be mad at me if I ask them for something new, or my doctor said not to bother getting genetic testing, but I did and I found this option now. How do I tell them I went and did it anyway? And all these fears about the doctor being mad or refusing to treat them. Your doctor will not be mad, and they can't refuse to treat you. And if you're providing your doctor with good medical science-based research specific to the genetics of your body, the somatic mutations of your tumor, there's no reason for them to be frustrated or annoyed, especially if you're showing up, bringing all the paperwork required for them to go along with the recommendation. So right now, for me, patients being well educated, knowing how to advocate for themselves, and then following through on that, I appreciate how much that takes, how much courage, how much mental strength and determination that takes. And I'm here for it. I completely admire it, and I'm here to help every step of the way, for sure.